Ma'am, we are live now. I request you to grant me the permission to start the session, ma'am. Hello,
Yeah,
ma'am.
Karthik, sure.
Thank you, ma'am. Ariom, everyone. A warm and heartfelt welcome to the 38th session of our lecture series, a prestigious lecture series designed exclusively for the first year and fourth year BMS students. We are delighted to have you all here today. But before we embark on this enlightening journey, let me take a Let me take a moment to introduce you to Jignasa, a pan India platform driven by the student community of Bharata within the Ayush fraternity. Our motto is simple yet powerful: learn Ayush to practice Ayush. We strive to empower Ayush students from campuses to communities, bridging the gap between students, policymakers, and administrative authorities. Jignasa serves as a unifying force connecting every aspect of Ayush, including students, academicians, practitioners, scientists, industrialists, and hospitals, all under one inclusive umbrella. We firmly believe in thinking globally while acting locally, working tirelessly over the past 2 decades to strengthen the Irish education system and instill confidence among Irish students. To achieve our goals, Jigdance has undertaken various impactful initiatives across the country, ranging from grassroots to international platforms, and some of our key initiatives include study circles, lecture series on specific topics, free medical camps, social health status survey, the health hands-on training workshops, conferences, interaction with eminent Vaidyas and academicians, brainstorming sessions engaging with ICE stalwarts, policymakers and key stakeholders, National Arogya Expo and International Conference, medicinal plant visiting, pharmaceutical visits, agitations for ICE students community advocating for the rights and demands of ICE students, private internship programs, interaction with traditional healers, online mock tests, social awareness campaigns promoting various concepts Ayurveda systems for societal well-being like Free Swarna Bindu campaign, Ashwashatatra Yoga, Group Savarya Namaskara, etc. Free healthcare assistance were also provided during natural calamities and accidents through local governing bodies from our organization. Our last session was a testament to the overwhelming response and enthusiasm from students. With over 400 live participants and more than 25,000 views so far, we are humbled by your active engagement and dedication to learning. At Jignasa, we understand the financial challenges that many students face when it comes to accessing commercial study platforms. We firmly believe that education should be accessible to all regardless of their financial constraints. Hence, we are committed to providing a helping hand to every student fueled by the burning desire to learn. With the support of experts in the field, we offer you the opportunity to learn the subject with no financial burden. And all we ask for is your unwavering interest and passion for knowledge. Today, we are honored to have Dr. Pavitra Hombanna ma'am, BMS MD Ayurveda, Assistant Professor, Tapona Ayurvedic Medical College and Hospital, Davangere. Ma'am completed her UG from SDM College of Ayurveda and Hospital, Udupi, and PG from SDM College of Ayurveda and Hospital, Hassan. Ma'am has presented the thesis on the efficacy of Tulsi Arka and provide on iodine in pre-operative skin preparation in perineal abscess in SDMCAH Hassan and registered under RGHS Karnataka, India. Ma'am has assisted in research for the evaluation of efficacy and safety of Arshahita tablet and ointment in fissure in ANO in SDMCAH Hassan for Sri Dudh Papeshwar Limited. Ma'am has participated in Brugashira project conducted in SDM Hassan and Brugashira Nakshatra in Tamakashwasa and Pranamaha Srota Vikara. Ma'am has also published article entitled Jigane Emda Vaidya in Suddhivira district newspaper. Ma'am, we are delighted and honored to have you on the session today. We extend our warmest welcome to you, ma'am, and to each and everyone who is watching this. We hope that you will find this session helpful. Ma'am, now I request you to carry this session forward from here.
Yeah, Karthik. Thank you. Thank you so much. Thank you, Karthik. Thank you so much. Thank you, Jignasa, to giving me this chance. Myself, Dr. Pavitra Hombanna, BMS MS Shalya Tantra, currently working as assistant professor in Tapona Ayurveda Medical College. So, moving on with today's topic. So today we are doing this session as a topic of exam orientation and strategies that you can follow in writing Shalya Tantra examination, especially your final year students who are logged in here. Thank you very much for coming. So next slide. So usually the content of today's lecture will be preparing how you will be able to prepare a self-study timetable. Secondly, knowing the syllabus, which is most important. Third, allocating time for each subject, like how you can cover each subject separately. Then knowing about allocation of marks for important topics in Shalya Tantra, how different marks have been allotted for different topics. Then structuring the answer, most importantly. You will study everything, but last, when you will be writing the exam, that is where it falls short. So that also we will be discussing at the end. Next one. So initially, how to prepare a self-study timetable, how you'll be able to prepare a self-study timetable. First one is to allot equal time for each paper. When you're studying, you cannot differentiate between the paper. As of now, you're in UG, so you cannot differentiate between any of the papers, and equal time should be allotted for each and every paper. Okay, so next you will have to cover at least two subjects per day, two if possible three, because now time is very constrained. You hardly have one more week left for the exams. So because of the time constraint, you will have to squeeze in another subject. So two to three subjects every day you will have to cover. Okay, that you have to keep in mind. You cannot study just one subject per day, because that you will leave the other subjects in that run. Okay, so that's why I would advise you to cover at least two to three subjects per day. Make it a timetable that you are able to accommodate two or three subjects every day. Okay, then after that you should do a revision. Okay, every day when you're starting your study, you will have to revise initially for 1 or 2 hours. 1 hour probably, because you don't have much time. Whatever you have studied the previous day, you will have to revise it for 1 or 2 hours, and then you have to continue with your that day's study. Okay, if many of you have already studied and finished and you're revising now, well and good, but revise everything that you have studied on the previous day before starting your next day. Okay, so then each subject you have to allot minimum of 6 hours if possible. Right now I am not sure if everybody is able to allot 6 hours for a subject in per day schedule. Try allotting. If not possible, at least come make it at least 5 hours. Okay, next slide. Karthik, thank you. Then you'll have to make notes. Try making notes. I wouldn't suggest you to prepare whole notes at this point during the examination time, but if you have prepared earlier, try revising from that. And if you have not prepared, at least in the textbook, try stick notes. Minimum basic necessities, at least that. Stick notes and write extra points in the textbook, or if you're referring one textbook, points from the other textbook, you can write it down using a stick note. If not, a complete notes would have been most apt. But if you're not there at this point, you can at least use stick notes along with the textbooks. Okay, then try keeping a separate shloka book, which is I think for paper 1, it is very much necessary that you're by hearting shlokas. Okay, so for in order to complete your paper 1, you need shlokas. So for that, if you have kept a separate shloka book, well and good. If not, at least mark those shlokas wherever possible. Highlight those shlokas. I've seen students using highlighters so much, so you can use those highlighters here. Use it to mark all the shlokas. And not just marking, you'll have to dedicate a separate time to revise those shlokas every day. I would suggest 30 minutes, but whatever the time you can allot, you have to dedicate time to revise all those shlokas. Okay. Next would be most important one. Whatever you're doing, you have to sleep well, hydrate well, eat well. Okay. What happens during exam season is you're more concentrated on studying. You'll keep 12 hours for studying. Few people have a tendency of peeing again and again, so they avoid drinking water, which is not advisable. Okay, even though you have to go time to time, but it is a must that you keep hydrating yourself. Okay, don't reduce your sleep time to less than 6 hours. Sleep sufficiently for 6 hours, don't reduce it less than 6 hours. Okay, if you're sleeping well, you're fresh enough to get up and prepare for the next day. Or when if you're going for exam, sleep well before going. Have a very nutritious diet. Don't eat junk during the exam period. People who are in hostel, try having healthy food, especially who are in hostel. At home, your parents, I know, will take care of it, but when you're in the hostel, it is very necessary for you to concentrate on your diet as well. Okay. Probably the next part, many of you will not do exercise, yoga or pranayama. It is necessary. Try at least pranayama. When you take a gap in between reading, which you have to, you cannot read continuously. When you're taking a gap, do a small session, 15 20 minutes of pranayama, and then go back to studying. See the difference. You'll experience a better understanding and a better grasping capacity once you finish a small session of pranayama before going back to your study. Okay, then try taking Medhya Dravyas. You can take anything that you want. It works. I'm not advising just out of context, but it works. Okay, you can take anything that is available, Shankapushpi, Mandukaparni, or any preparations that is available as Medhya Dravyas. So I would advise you to take. At least it will calm your nerves. It might not increase your media for meda for your exam purpose, but at least it will calm your nerves. You'll feel more calm before reading. Okay, next. Okay, so moving on to the syllabus, we'll see each topic. I've tried covering each topic, and I'll be telling you the important aspects of each topic with respect to the exam. How much marks each paper or that each topic will contain, and how you will have to concentrate on every topic. Okay, so in paper 1, part A, the first two topics, introduction of Shalya Tantra and Yantra Shastra and Anushastra. See, in part A, first paper, in general, first paper, it usually contains all basic concepts. Okay, all Samhita concepts. I would advise you to refer Samhita for part paper 1. Okay, paper 1, at least the first 30 chapters. Okay, Sushruta Sutrasthana, first 30 chapters you will have to refer in order to cover your paper 1. Whatever you're reading, compiled books, either Jalaluddin or Rajneesh Vigiri sir's textbook, whatever compiled textbooks you're using, but try a cross reference or keep a cross reference with the Samhitas. Okay, in the first point, you will have introduction to Shalya Tantra. Okay, so first paper, first part A, usually in every question paper, if you take out, you will find the first question, the 10-mark question, coming from these two topics, introduction to Shalya Tantra or Yantra Shastra and Anushastra, this topic. Okay, the first point in introduction to Shalya Tantra, it carries 3 marks, 5 marks, 10 marks. All these three categories, questions can come from this topic. Starting from definition of Shalya Tantra, importance of Shalya Tantra, historical background, including the contemporaries of Sushruta Samhita, and importantly, the cause of decline of Shalya Tantra. Okay, that is one important topic that you'll have to concentrate on. Then coming to shlokas, you'll in the first topic you'll have to by heart all the shlokas, including definition of Shalya Tantra. That is compulsory. There is no ifs and buts to this particular topic regarding the shlokas. So for this topic, you can refer Samhitas, as well as I would prefer referring Rajneesh sir's book. Okay, then comes your Yantra Shastra and Anushastra. So this particular topic, this carries 5 marks to 10 marks. Okay, a 10-mark question or a long essay question can be direct. Explain about the yantras, enumerate the yantras. That can be a 10-mark question. So along with that, you will have to study everything in this particular topic. You cannot leave anything. Yantras, if you come, types of yantras, okay, starting from there, tani shat prakarani tadyata, that shloka, sushruta sutra 7th chapter. Then you will have to by heart the different, if possible, by heart shlokas for each type of yantra. If not possible, at least remember those terms. Like in swastika yantra, there is a specific feature mentioned, how long it is. Okay, so those things you have to remember in, preferably in Sanskrita terms. Okay, the characteristics of those things, try remember, if not the shloka, try remembering the Sanskrita terms. Okay, the yantras. Then coming to shastras, you will have to by heart shlokas, the types or the classification of shastras. Then comes your shastra sampat, tani sugrahani sulohani, that shloka. Then shastra karma and shastra payana. Shastra payana vidhi, usually it will be asked repeatedly. It was asked for 3 marks question. So try by hearting that shloka. If not possible, as I told, you have to mention the Samskrita terms specially dedicated for those things. Okay, then comes your upayantras and anushastras. Upayantra and anushastra shlokas are must. Okay, if not, if possible, at least enlist those. A short term, I mean, or short tip for that would be, make a story out of it. I usually tell it to my students. If the shlokas are very big, the classification is too long, having at least 20, 22. Here in upayantras you will have 24 types. So to by heart all those things, it will be a little difficult when you have everything together. So try making a story. Okay, then go for then if you try to remember, it will be easier. Okay, then enlisting at least will become easier. Same applies to your 25 types of upayantra, then anushastras. Okay, so all these things, they are important. Even if you are finding it difficult, it is important that you concentrate on these. uh, Again, if you come to these things, commonly asked one is your Plota and Pichu. I think there was one question when we were referring to old question papers. Plota and Pichu were the one being repeatedly asked. So that is nothing but your the surgical gauze that we use, and the sterile cotton that we are using. Okay, so that is Yantra, Shastra, and Anushastra topic. These two topics are very important, so do not neglect these two topics. Next. Then comes Nirjantukarana or sterilization. This particular topic is having a distribution of either 3 marks or 5 marks question. So methods of Nirjantukarana mentioned in, there are different um, mentionings in Sushruta Samhita regarding Nirjantukarana. In Shashti Upakrama, there is mentioning of Nirjantu. It's not direct mentioning, but there's a broad mentioning of Nirjantukarana there. And apart from that, sterilization methods, types of sterilization, chemical sterilization, and autoclaving. Okay, usually this will not be asked as a 10-mark question. This will usually be a 5-mark question. Okay, types of sterilization, chemical sterilization, and autoclaving. Okay, then comes Sanyaharana or anesthesia. Again, a preferable long essay question or a 10-mark question. Most commonly, what you have to concentrate in Sanyaharana or anesthesia is the regional anesthesia. Okay, regional anesthesia, you will have spinal, epidural, and in one question paper, there was something called as peripheral nerve block. All these come under regional anesthesia. So, if you're concentrating on anesthesia, these are the points that you'll have to cover. When coming to general anesthesia, again, general anesthesia independently can be asked for a 5-mark question. Okay. Important in general anesthesia are the stages, 4 stages which are mentioned in GA, along with changes what will happen in those stages. Okay. So any other questions in anesthesia would be types, drugs used in different anesthesia. For regional, it will be different, and for general anesthesia, it will be different. Then complications of anesthesia. These can be of together. They can be a 5-mark question. Okay, so one question from this topic will be there in every paper. So you can expect one question, either 3-mark, 5-mark, or 10-mark from this topic. Next. Then comes your Trivida Karma. Probably your lecturers also might have told the most important topic, Trivida Karma. For Trivida Karma, you will have to read the Agropahaniya Adhyaya, Sushruta Sutra, 5th chapter. Without reading that chapter, you cannot understand Trivida Karma according to Sushruta. Okay, for this you will have to refer the Samhita. Then majorly Purva Pradhana Paschat Karma, they can be asked individually. Okay, especially the Pradhana Karma, you will have to concentrate on the types of incision, qualities of incision. Everything is being mentioned: qualities of incision, counter incision, qualities of counter incision, and mainly qualities of the surgeon. Each shloka is important. Okay, I repeat, each shloka of Pradhana Karma, types of incision, qualities of counter incision, and qualities of surgeon. These 4 shlokas you cannot leave out, or at least those words, technical terms, what are there, you have to include in your answers. Okay, then comes in this thing, types of incision. You have 3 types mentioned in Sushruta: Tiryak, Cheda, Ardhachandrakara, and Chandrakara. If not the shlokas of these things, at least you will have to describe. You must know how they are being taken, how the incisions are being done. Okay, then Purva Karma, Pradhana Karma, and Paschat Karma. This can come in whole as a long essay question. Okay, or a 10-mark question, a compulsory topic for either 5-mark or 10-mark question. You can expect one question in either 5-mark or 10-mark, 100% from this topic. Okay, then comes Ashtavida Shastra Karma. In Ashtavida Shastra Karma, from Chedana to Visravana, all shlokas are important. You might be thinking, ma'am is telling everything about shloka, but for paper 1, it is necessary that you read shloka. Probably you would have known by now, if not at least those technical words. Shloka specifically, though the Ayurveda terms which are present, if you are not able to form the shloka, don't make your own shloka in the paper. Try writing only those technical terms. Okay, from Chedana to Visravana, you have to by heart all shlokas, each Shastra Karma. Okay, then important question can be either to numerate the Ashtavida Shastra Karma, and along with that a specific karma, either Chedana or Vedana, any one they can ask you to elaborate. That can be a 10 marks question. Okay, for 3 marks they can also ask any one karma. For 3 marks you just have to write what that karma is, indications of that karma, that would be sufficient. Okay, so this specific topic, you can write first the shloka, give a definition, and try writing in subheadings about the indication, instruments used, etc. And there are important yogya vidhis that are being described in the next chapter, that also you can include in the Ashtavida Shastra Karma. Usually few students, they do not include. You can include that. There are yogya vidhis mentioned for Chedana, Bedana, etc. Those yogya vidhis can also be included in the Ashtavida Shastra Karma. Okay, so this is an important topic that you have to revise again and again. There is every chance that this gets evaporated from your mind, so try revising this particular topic again and again. Okay, next. Then comes your yogya vidhi or your experimental surgery. In this particular chapter, he has mentioned everything regarding the practice of surgery. Okay, so Sushruta is the first person who is advocating the practice of surgery in various models like vegetables and fruits. That thing you have to keep in mind. Okay, and that you have to correlate with the present day where we are using surgical models, simulators, etc. those points, they should be highlighted. Okay, so these were the first advocated points of Sushruta, the Yogya Vidhi. There was no previous mentioning apart from Acharya Sushruta. In the 9th chapter, Yoga Vidya Adhyaya, Sutrasthana, he is mentioning about all these aspects, the experimental surgery, that you have to keep in mind one thing. You have to know the karma, what is especially he is mentioning, like for nirharana, he is mentioning you can do it on a tooth, on a skull. Those things specifically that you will have to remember. That is Yogya Vidhi. Next, then comes your Marma Adhyaya. Yeah. Usually, we give a lot of time to read Marma, but in the question paper, it's not given that much of importance. If you have come across all the question papers, 1 or 2 papers will have this Marma Adhyaya as for 10 marks. Okay, but yeah, as a student, I myself had read Marma for a very long time. But if you open the paper, it will not be much given on Marmadhyaya. So don't be disheartened by that. You will have studied already about Marmadhyaya, this specific topic. It can have a 10-mark question. Okay, it can be a long essay question. It can be like enumerate the different marmas explained by Sushruta and explain one particular, anyone, Sadhyo Pranahara or Kalantara. Like that, they can ask for 10-mark question. Okay, from the Nirukti, you'll have to start and you have to describe the types, Sadhyo Pranahara, Kalantara Marma, etc. And there can be questions with individual Marma, like Stapani Marma. You'll have to write where the Marma is situated, what type of Marma it is. This can be asked, individual Marma can be asked for 3 marks. Maximum, if you dedicate 3 hours for this particular topic, I think in whole, it would be sufficient for Marma Adhyaya. Okay, then 100% question is your next 3 topics. What you have, the Kshara, Agni and Rakta Mokshana or Jalakavacharana, what you have. Okay, so Kshara Karma, you have to by heart shlokas, of course. Nirukti, Kshara Guna, Kshara Dosha, Kshara Karma, shlokas are very, very, very important. Okay, then Kshara Sutra Nirmana Vidhi, you will have to study about it. It can be a potential 5 marks question. Kshara Sutra Nirmana Vidhi, advancements in the field of Kshara Sutra preparation. Okay, the recent advances what are going on, probably you will find that in Jalaluddin textbook. Okay, then for 3 marks, you can also have Kshara Dosha, Kshara Karma, indications and contraindications of Kshara Karma. Okay, they can also ask for Kshara Varti, Kshara Pichu and Kshara Taila. The last 3 topics in Kshara Karma, Kshara Pichu, Kshara Varti and Kshara Taila, they can be asked for 3 marks. Okay, then comes your Agni Karma. So next important topic. So you have to start from derivation of Agni Karma, how the term Agni Karma has been derived. Then indications of Agni Karma, types of Agni Karma. Most important in this topic is your Dahana Upakarana, or the instruments used for Dahana Karma or Agni Karma. Example, you have that shloka, Pipali Aja Shakrit Godanta Sharashalaka. That shloka has to be mentioned if at all there is question about the Dahana Upakarana. Then Agni Karma Yogya and Ayogya, very important. Okay, then last point that you have to cover in Agni Karma, most of them miss this point, Dhumopatah Lakshana. Okay, this can be a potential 5 marks question, so don't leave that topic. Just go through that topic. It is a very easy topic, so just go through what it says. Dhumopatha Lakshana. Okay, then whole topic, whole Agni Karma can be asked for 10 marks. Okay, one whole Agni Karma topic is a potential 10 marks question. Then comes Rakta Mokshana. Rakta Mokshana, important one, you have Jalakavacharana. Procedure you have to know. Okay, how the whole procedure is being carried out. So when Jalakavacharana Vidhi is being asked, you are supposed to write Purva Karma, Pradhana Karma and Paschat Karma with respect to both Jalauka and the Rogi. You cannot miss both. Okay, you have to categorize your answer. You have to write both how you are doing purva karma. Example, you're taking the jalauka, putting it in a haridra churna and water combination, allowing it to activate. That will be a purva karma for the jalauka. If you're taking for the patient, you're doing CTBT etc. as a preoperative procedure in jalauka charna. That you will have to write for with regards to the rogi. Okay, that was an example. You have to write the same for pradhana karma and pashat karma, what you're doing mainly in pradhana karma. Okay, that you have to categorize what you're doing for jalauka and what you're doing for the rogi. So that will be a potential 10 marks question. Okay, you should also include, if jalauka avacharna is asked for 10 marks question, you have to include importance of jalauka, types of jalauka, sarvisha and nirvisha jalauka, if possible by heart the shloka or at least remember the names. Okay, also you have to mention procedure with its division with respect to jalauka and the patient, as I told. Okay, other types of rakta mokshana can be a potential 3 marks question. Siraveda, alabu, shringa, they can be a 3 marks question. Okay, then comes bandha vidhi adhyaya. Bandha vidhi, a potential 3 marks or a 5 marks question. Okay, individual bandha can be asked for 3 marks. They'll not ask you as a kosha bandha or a dama bandha. The question will not be like that. Question will be directly as kosha or dama. You shouldn't get confused, and if you know all the 14 bandhas, it'll be easier for you to find out that this particular word is with respect to the bandha. Okay, so they are, these all 14 are important. Here again, there is mentioning of Pichu and Plota. If possible, just give a glance over those because it is repeatedly asked. Pichu and Plota are present probably in 2-3 question papers. They are repeatedly asked. Okay, next. Okay, one more important topic in this part is your Pranashta Shalya. Okay, usually a 10 marks question will be to explain the Pranashta Shalya Vidhi Adhyaya. Complete Pranashta Shalya Vidhi Adhyaya, you will have to explain for 10 marks. That will be a 10 marks question. Or for a 5 marks question, Shalya Nirharana Upaya. Like how, from how you will find out how to diagnose there is a Pranashta Shalya to how you will do a Nirharana of that Pranashta Shalya. Those things have to be explained for 5 marks. Okay, then for 3 marks, Shalya Gati, there are 5 types of Shalyagati, if you remember. Those Shalyagatis, they can be asked for 3 marks. Okay, so that is Pranashta Shalya. That was majority of Ayurveda topics in paper 1, part A. Okay, then in part A, you have few modern topics like fluid, electrolyte, acid balance, and nutrition. So common question in this topic would be respiratory acidosis and metabolic acidosis, respiratory alkalosis or metabolic alkalosis. Remember the symptoms and the management. Okay, just these 4 if you remember, that would be sufficient in acid base balance. So other common questions would be parenteral nutrition. Important. That is a potential 3 marks question. Parenteral nutrition, they can either ask as parenteral nutrition or also as amrita jala suchi barana chikitsa. Okay, so that is a common term being used for parenteral nutrition. This question is for 3 marks. Okay, then next. So then most frequently asked question is your rakta stambhana upaya. Next. Yeah, rakta stambhana upaya in the next topic. Then you will have types of classification of hemorrhage, types and classification. Then blood transfusion, not repeatedly asked, but yes, you will have to know about what is being done in blood transfusion. Preoperative, again, preoperative, operative, and postoperative. What we do before any blood transfusion, BT, CT, blood grouping, etc. Those things you will have to know. Then compatibility tests, indication of blood transfusion, and mainly complications of blood transfusion and how to manage them. Okay, so in whole, blood transfusion individually is a potential 5 marker question. Okay, so then comes your antibiotics, analgesics, anti-inflammatory. This is a topic that everybody will skip, thinking that they'll not ask. Emergency medicine can be asked for a 3 marks question. Okay, any one specific drug or a group of drug can be asked. If at all there is mentioning of antibiotics, there can be they can ask separately as a cephalosporin, very less because it is not a pharmacology paper, but you'll have to know at least the groups of drugs. I would prefer you to know cephalosporins, tetracyclines, or macrolides. You'll have to know the groups. Okay. In emergency drugs, at least 3 drugs you'll have to list out and you have to read about them. 3 drugs you will have to prepare for both 3 marks and 5 marks. It can be what I would prefer is atropine, adrenaline, or any of the steroids like your hydrocortisone. These 3 drugs, usually people prepare these 3. I would also prefer these 3 for 3 marks or 5 marks. Okay. So in these, what you'll have to remember as a drug dose, the indication, and the route of administration. Okay, if you're making headings, make write down drug dose, indication, and route of administration. Okay, next. Then we have diagnostic techniques. Okay, a 5 mark question. Usually the commonly repeated one is the FNAC, fine needle aspiration cytology. It can be asked for a 3 mark question. Okay, so usually people will neglect this topic. Just remember about the principles of X-ray, ultrasound, CT scan, or MRI. What is a basic principle? How it is being carried out? What procedure is being involved? Basically, underlying what are the principles? Like in X-ray, what is the principle? In ultrasonography, what is the principle? Okay, those things are important in this particular topic. A 5 mark question can come as relevance of radiological investigation in a particular surgical disease in specific. Like example, you have arterial diseases. In the arterial diseases, what all diagnostic procedures you are using? Why is it important? That can be a potential 5 marks question. Okay, next, that ends your paper 1 part A. Then comes part B. Next. Okay. So part B, first point is your Shatkriya Kala. You might have read Shatkriya Kala from first year, second year, third year, even in final year, you have Shatkriya Kala in your KC paper. Okay, here in Shalya Tantra, Shatkriya Kala is having a interpretative, significance in Shalya Tantra. Okay, you're supposed to interpret the Shatkriya Kala or the disease which you know with respect to Shatkriya Kala. Okay, example, like you have appendicitis, you will know the different features or how the disease is progressing. You have to correlate that along with Shatkriya Kala. Chaya Prakopa Prashama, you have to write the symptoms of appendicitis that is progressing. Okay, till Bhedavastha, you will have to correlate those disease. Commonly, if you're most commonly asked are appendicitis, cholecystitis, or your hemorrhoids. Okay, those things you will have to correlate. Try making it now itself. Like if you have not done it till now, try correlating or try making an answer out of keeping a symptoms of appendicitis or cholecystitis in one side and the Shatkriya Kalas on the other side. Okay, so that is a potential 5 marks question. You have to interpret the disease with respect to the Shatkriya Kala. Okay, then comes a potential long essay question, that is Vranashota. Vranashota is like food and water in Shalya Tantra. It should be there in the question paper. Okay, so Vranashota, here shloka of Amavastha, Pachamanavastha, and Patvavastha is important. So again, Vranashofa, Saptopakrama is commonly expected question. Don't skip this shloka. Saptopakrama is very important. Okay, Saptopakrama, you have to enlist, either you have to enlist it and you have to remember individual procedures, how they are done. Okay, then comes Vidridi. Vidridi, definition and types. It can be a 5 marks question. And every time you're writing an Ayurveda concept, you will have to correlate it with a modern one. Vidridi is correlated to abscess. So in abscess, you have to remember the type. definition, and the treatment. Okay, so in treatment of abscess, if at all it is asked for 5 marks, you are supposed to write, or you are expected to write, the surgical treatment. Okay, not regarding the antibiotics and analgesics. Yes, you have to write, but we are not expecting, or we are not concentrating on the antibiotics and analgesic part. We are concentrating on the surgical treatment part. Okay, at least you have to mention it in two headings. Try mentioning it in as a treatment, as a medical treatment, and a surgical treatment. In medical treatment, you can write antibiotics and analgesics, whereas when you come to surgical treatment, you have to mention in abscess IND, incision and drainage. Okay, then you can advise the patient to go for antibiotics and analgesics. That is fine, but initially, this is Shalya Tantra paper, so you will have to write about IND. Okay, then comes Pidaka. So Pidaka can be you have to remember the correlation with the Nadi Vrana, again, is a 3 marks question. Obviously, this is Shalya Tantra. Most important topics are sinus and fistulae. So if at all you are not sure with sinus and fistulae, kindly refer ESDA's manual of surgery. Okay, you will have a precise explanation of sinus and fistulae, so you can refer that book. So again, then in after that you have Vrana Granthi. Usually 5 marks to this topic is given when we are asking both keloid and hypertrophy, both if at all we are asking. That would be a 5 marks question. Difference between keloid and hypertrophy scar. Okay, that is a 5 marks question. Then if at all asked individually, like keloid if we are asking separately, hypertrophy asking separately, then probably it is a 3 marks question. Okay, so next is shock, Marma or shock. It is a 5 marks question. Yes, you have to define shock, explain type of shock. That will fetch you a 5 marks. Okay, next is gangrene. I think gangrene is one neglected topic by UGs. They don't read much about the gangrene and principles of amputation. Okay, so in one paper, usually if kotha is given, it will be given as kotha, not as gangrene. Okay, so you have to write about kotha initially. In the introduction you have to write, then you have to move to gangrene. Okay, then in amputation, try mentioning the types if at all asked about only about amputation. Example, in foot amputation you have multiple types: Boyd, Sims, Choparts, Lisfranc, etc. Those things you will have to at least try to remember the types. Okay, then we have Granthi can be asked for 3 marks. Granthi or cyst can be asked for 3 marks. If at all you want to read extra for cyst, again mention ESDA's surgical manual. Okay, then you have Arbuda. Okay, in Arbuda or tumors, TNM classification is important. It's actually easy. Everyone thinks it is very difficult to remember TNM classification with respect to that particular tumor. Example, you have esophageal tumor. An example. So TNM classification, you should base it on that particular uh, anatomy of that particular organ. Okay, tumor, node, and metastasis. Usually metastasis will happen initially in the surrounding area, so that you have to keep in mind. Small logics you have to apply and you have to remember. You cannot by heart everything, so somewhere wherever possible you have to remember one small logic through which you can remember everything. Okay, the TNM classification is constant, almost constant, not always constant, almost constant to almost every tumor or a benign, a malignant and a benign tumor. Okay, so there is no much headache to be taken on TNM classification. Again, Arbuda and tumor along with the TNM classification can be a 5 mark question. Okay, next. Yeah, this is like bread and butter of Ayurveda. Sorry, of Shalya Tantra. Vrana Chikitsa. Okay, so it carries 15 to 20 marks in each paper. Each paper in part B, it will have 15 to 20 marks. So all shlokas here are important. From Vrana Nirukti, types of Vrana, Dushta Vrana, Shuddha Vrana, Ruhyamana Vrana, Samyak Ruda Vrana, and Nadi Vrana. All the shlokas are important. Okay, all the 5 Vrana shlokas and Vrana Pariksha. Okay, so Vrana Pariksha, Shatmulo Ashtaparigraho, that shloka is very, very important. Shatmulo Ashtaparigraho Panchalakshana Lakshitaha, that shloka you will have to by heart no matter what. Okay, then Vrana Pariksha, only Vrana Pariksha itself, it can be asked for 5 marks. Okay, all aspects of Vrana can be asked for 10 marks question, including all, if everything is being asked. Describe Vrana Chikitsa for 10 marks, then you will have to explain everything from definition of Vrana, Nirukti of Vrana, from there till the Chikitsa aspect. Okay, that will include again your Pathya and Apathya of Vrana. Okay, Pathya and Apathya of in Vrana, it can be a 5 mark question as well. Okay, if asked everything together, Shashti Upakrama, you just have to enlist them. Shashti Upakrama separately can be asked for 5 marks, but if it is included along with Vrana, you can concise it and write just the names of the Upakramas. Okay, Shashti Upakrama, if possible, remember the shloka. Shashti Upakrama individually can be asked for 10 marks. Okay, if possible, remember the shloka. If not possible, again, I told previously, you can make stories out of whole enlisting the whole Shashti Upakramas, and that story you can remember uh, during your exam times. Okay, now is not the time to make the stories. I remind you again, if you make it now, it will be very difficult for you to remember. So don't make it now. You should have made it priorly. But if not, just ask whoever had made it. Whoever have made it in your class, ask them if they can share that story. Don't try new techniques now because you don't have much time. Okay. Then Raksha Karma, very important, 3 marks to 5 marks question. Raksha Karma according to Ayurveda. As I told priorly, during sterilization, Raksha Karma is or Nirjantu Karana is mentioned here in Vrana Chikitsa. So that can be a 5 mark question. Okay. Then Agantuja Vrana. Next. Agantuja Vrana, in that Sadhyo Vrana is important. Okay. Sadhyo Vrana. Then comes Dagda Vrana. Dagda Vrana, rule of 9 is important. Rule of 9 can be asked. Curling's ulcer was there in one of the question papers. So Curling's ulcer is actually a complication of 4-degree burn, usually around the abdominal area. So that was being asked in one of the question papers for 3 marks. Okay, so individual these things can be asked for 3 marks, but as such, Dagda Vrana, it can be asked for both 3 marks and 5 marks question. Okay, then comes Shudra Roga, a potential 3 marks question. These ulcer, wound healing, and its management is a must. There is no there is no question of reading or not reading. It is important. Even if I don't mention, types and management of ulcer is important. Stages of wound healing, yes, it is important. It can be asked for 5 marks. Both can be asked for 5 marks. Okay, next. Yeah, in Kshudra Rogas or in Twakvikaras, you will have Twakvikara as a topic. So in that, you will have Kshudra Rogas. Try learning or listing up the Kshudra Rogas according to Sushruta. Okay, there can be a question regarding the difference between Chippa and Kadara. Okay, Chippa and Kadara. Chippa you can correlate to Paranikia, Kadara you can correlate it to corn. So Kshudra, in Kshudra Rogas, these two can be a potential 3 marks question. Usually not for 5 marks. If asked Kshudra Roga for 5 marks, usually it will be everything from classification of Kshudra Roga till an explanation of any one of the Kshudra Rogas. Okay, that can be for 5 marks, but usually not asked. Okay, then comes Manya Vikara. Manya Vikara, again a 5 marks question. Apachi and Galaganda are important. Okay, shlokas for both you have to do. If asked, definition of Galaganda, Definition of goiter you will have to write. Then treatment of goiter, when we are mentioning the treatment, you will have to mention again about medical treatment and surgical treatment. Okay, since this is Shalya paper, you have to concentrate more on surgical aspect, surgical treatment. You have to mention about thyroidectomy in goiter. Okay, but you cannot neglect the medical treatment. You have to give a mentioning about that also. Okay, next. Next is Sira Vikara. Yes, Sira Kautilya, important. Like you have varicose veins. That is important topic that you have to concentrate. And Sira Vikara, a potential 5 marks question. Stages, diagnostic method, management. Okay, you have to mention here. So then comes your Dhamani Vikara. Dhamani Vikara, majorly few points are there, like examination, symptoms. When you come to Burgess disease or Raynaud's disease, majorly in Burgess disease, you have few symptoms like rest pain, claudication, superficial nodular phlebitis. Those things, those specific uh, uh, signs and symptoms, it is very important for you to remember. Okay, then an important question here would be difference between Raynaud's phenomena and Burgess disease. Okay, that can be a potential 5 marks question. Okay, next. Snayu Vikara, commonly asked as tennis elbow and ganglion. Um, 3 marks, I think, majorly asked would be tennis elbow for 3 marks. Okay, then is care of AIDS and HIV and hepatitis patients. In Shalya Tantra, this topic is important regarding the precautionary aspect. Okay, this is mentioned why? Because during any of the surgeries, we have to know what precautions are to be taken while taking these patients for surgery. AIDS, HIV, or hepatitis patient for surgery, what all precautions have to be taken in the OT and to the staff who is performing surgery. The safety of the staff and the precautions, those play an important role in this particular topic. Okay, a 3 marks question, or sometimes if possible it can come for 5 marks as well. Okay, next. So that completes paper 1. Then we have paper 2, part A. In part A, most common long question is your bhagna. Opening is with bhagna. Okay, so bhagna, sandhi moksha, both are important topic. In that bhagna, you will have to study about the types of bhagna mentioned along with the treatment, then types of fracture, clinical features, and treatment protocol. What are to be followed? Okay, so for 10 marks, you can have explain types of bhagna along with the treatment and explain any one fracture. It can be either fracture of clavicle, fracture of femur, one fracture they can ask for 10 marks. Okay, if that is asked, a fracture is being asked, you will have to start with mechanism of fracture, clinical features of fracture, investigation, complications, and treatment. Again, in treatment, you will have to write whether you're doing an open reduction or a closed reduction, which is being mentioned in that particular fracture. Okay, bhagna as such individually is a 10 marks question. Okay, so along with the treatment and the types of bhagna, you will have to remember. Okay, then comes diseases of bones. In diseases of bone, you have to concentrate majorly on osteomyelitis. One disease that in every paper can be asked in this particular heading would be osteomyelitis, TB spine, and pot spine. TB spine, pot spine can be a 3 marks question, whereas osteomyelitis can be a 5 marks question. Okay, it's also called as Majja Paripaka. You can get any word, either Majja Paripaka or osteomyelitis. Okay, next. In craniocerebral injuries, important what you have to concentrate is fracture of skull, epidural hematoma, and subdural hematoma. All are individually 5 marks question. You will have to write clinical features and the line of treatment. Okay, clinical features, what you will do, investigations, and the line of treatment. Okay, then in diseases of spine, ankylosing spondylitis, and then disc prolapse, IVDP, what we call, that is commonly a 5 marks question. These two topics you will have to concentrate more in diseases of spine. Okay, So then comes all are your important modern topics. Next, everything like diseases of breast, if we come. So these all topics are dominantly modern topics. There will be Ayurveda mentioning, obviously, but I would prefer you to read Manipal manual, because it is having a clinical picture is being given of those particular disease. Okay, along with that, a proper mnemonics or any points which will help you to remember, and that is being given in a very classified manner. A neat presentation is there in Manipal manual, so that you can refer. Even SRB you can refer, because once you see those images, it will be easier for you to remember the disease, because next all the diseases, you will have to know the surgical steps with respect to surgery. If you remember the features, if you see, you'll remember better. So try seeing the images from the Manipal manual or from SRB. Okay, so then coming to diseases of breast, it's a very important topic when you come to second paper. In that, you will have to remember the stana arbuda, stana vidradi. Okay, two topics you will have to concentrate more. Okay, in that, ca breast or breast abscess, individually they are 5 marks question. They can ask they can ask breast abscess for 5 marks. Ca breast and stana arbuda together, they can be a 10 mark question. Okay, then comes next, disease of chest. So in diseases of chest, next, diseases of chest, importantly, you have pleural effusion, tension pneumothorax, hemothorax, and including all these, you have to remember the line of treatment. So this is a potential 3 marks or a 5 marks question. Okay, you have one more this thing as a flail chest. Okay, flail chest can be a question for 3 marks. All these, pleural effusion 5 marks, hemothorax, and the line of treatment for tension pneumothorax, those can be a 5 mark question. Okay, so then comes diseases of esophagus. Diseases of esophagus, again a very important topic. A potential 10 mark carrying topic is diseases of esophagus, majorly ca esophagus. Okay, ca esophagus, stages, the TNM classification, management of ca esophagus, that is a 10 mark question. Okay, then esophagitis, GERD, then congenital anomalies of esophagus are important in diseases of esophagus. Okay, then gulma, in gulma roga, lakshana types, lakshana and upadrava. So usually this can be asked for 5 marks. Gulma roga, they can ask the types, lakshana and chikitsa for 5 marks. Next, then we have shula, shula roga or shula vyadi. Important is anadrava shula and parinama shula. Okay, these both can be a potential 5 marks question. You can also go through peptic ulcer if you want here, shula vyadi or shula roga. Then udara, udara roga, chidrodara is important 5 mark question. Okay, you can write intestinal perforation as a correlation for chidrodara. Then this particular chidrodara is being asked again and again. Okay, in multiple questions it is being mentioned. Then peritonitis and stages should be added along with this chidrodara or perforation, if at all this is asked for 10 marks. Okay, then Baddha Gudodara, you have to explain about intestinal obstruction as well. Baddha Gudodara, after mentioning about Baddha Gudodara, you have to mention about intestinal obstruction. Okay, so then comes diseases of stomach and duodenum. See, potentially the diseases of stomach and esophagus in a question paper, they will carry 10 to 15 marks. Without any doubt, they'll carry 10 to 15 marks. Okay, so diseases of stomach and duodenum, again this is having a 10 marks potency. So peptic ulcer, pyloric stenosis are commonly asked if you see the question papers. So another important question in this topic is ca stomach. Okay, CS stomach itself can be asked for 10 marks. Next, diseases of small intestine and large intestine together, I'll tell you. So in both diseases of small intestine, obstruction, perforation are important. Obstruction and perforation, you have to concentrate more. Diverticulitis, especially the Meckel's diverticulitis, that can be a 3 marks question. Okay, then most common question in large intestine, diseases of large intestine, is appendicitis. Okay, so appendicitis, no matter what, you have to prepare your own notes. You have to write it in your own way. You have to write an image how you will diagnose appendicitis. Okay, you should know the position of appendix. From there, you have to start. That is also having a diagram, a clockwise diagram with the position of the appendix. That is to be remembered. Clinical features, then manifestation of how the disease progresses, what is appendicular abscess, appendicular mass, and treatment, specifically surgical treatment. Okay, appendectomy. So in detail, you'll have to study about the appendectomy. You have to give more importance to the surgical procedure. Okay, pre-op, operative, and post-op. What all you're doing in appendectomy, that is to be concentrated more. Then you have Crohn's disease and ulcerative colitis. Individually, you can get it for 5 marks. Okay, but for in appendix or appendicitis can be a 10 marks question. Okay, so in large intestine, you can get one 5 mark or one 10 mark question. Fixed, there is no doubt on that. Okay, so then comes next one is your diseases of rectum and anal canal. Okay, so everyone, most probably everybody in Shalya Tantra is masters of this topic, so they would prefer keeping this topic in the question paper. Okay, so no matter what, you will have one question from this topic. Diseases of rectum and anal canal. Here you have to concentrate on arshas, parikartika, and bhagandara. Any one can be a 10 mark question because there is a detailed explanation even in Sushruta Samhita. So all these three topics, I'm not talking about the Parikartika, but the Arshas and Bhagandara can be a 10 mark question. Okay, then next topic is Guda Vidradi, anorectal abscess. So when asked about Guda Vidradi, you will have to also mention about the anorectal abscess, like the perianal abscess, ischiorectal abscess, submucosal abscess, etc. Those things you have to mention. Then comes Guda Bramsha. Guda Bramsha can be a 5 marks question. If asked, you will have to mention the grades of rectal prolapse. What is Guda Bramsha? You have to correlate it to rectal prolapse, and you will have to mention the grades of rectal prolapse and surgery. Okay, the Tischer's procedure, what we do, at least that one procedure you will have to mention in the answer. Okay, then comes your abdominal injuries. Probably a 5 marks question. Usually if they are asking abdominal injuries, it will be either stab wounds or a penetrating wound. So for that you can mention Manipal manual if you want, but a 5 marks question plus or minus, it can be asked or it may not be asked. Okay, next. So that was paper 2 part A. Then comes paper 2 part B. There is a small mistake in that. Paper 2 part B. So here completely are diseases which you have to read from Manipal manual. I would prefer reading from Manipal manual. Okay, so completely this whole topic is related to modern aspect. Okay, so you have to know about the surgical anatomy if you have to understand each topic properly. So if you want to study about the surgical anatomy, briefly will be given before every topic, but you have to understand it thoroughly. You can refer any YouTube channels. Okay, there are multiple, like you have Surgical Educator, Prep Ladder, Indian Medico. Those are a few YouTube channels that you can refer to in order to know about surgical anatomy. Okay, so what happens is, reading through those surgical videos, it is easier to remember. There is a very step by step explanation is being given regarding the surgeries, so those things help you to remember. First read the topic, then refer these videos. it will be useful for you to remember for a very long time. As I told, visual memory is a very long lasting one, so utilize that. Okay, since you have easy access to the internet, use internet in a very good manner. Okay, so coming to topics, diseases of liver and gallbladder will cover together. Commonly asked is liver abscess, amoebic liver abscess. You have 3-mark question regarding a few aspects in the amoebic aspect, abscess and liver abscess. Okay, then you have portal hypertension, 3 marks to 5 marks question. Anything can be asked in portal hypertension. Then hepatomegaly or Yakrit Dalyodhara is important. Okay, so in whole you can expect a 10-mark question in this diseases of liver. Hepatomegaly can be a 10-mark question. Okay, then in gallbladder you have important 2 diseases, cholelithiasis and cholecystitis. Both can be asked for 10 marks or 5 marks. Okay, commonly asked cholelithiasis and cholecystitis. Okay, then diseases of pancreatitis can be asked for 5 marks. Usually not asked for 10 marks, but for 5 marks it can be asked. Pancreatitis is important in diseases of pancreas. Next. Okay, then comes diseases of spleen. In diseases of spleen, you have plehodara, which can be asked for 5 marks. Then one more question is your splenectomy. Okay, there is a step-by-step explanation of splenectomy. If you refer Rajneesh sir's book, Rajneesh Giri sir's book, there is a step-by-step explanation of splenectomy. So refer that for an easy explanation. Okay, then almost 25 marks in paper 2 in part B is from Mutravaha Srotas. Okay, Mutravaha Srota Vikara, you can have about 25 marks in your paper 2 part B. Okay, usually what we do, we are writing the features, but majorly we are missing the investigations in this part. Okay, so investigations in Mutravaha Srotas, you can have like retrograde pylography, intravenous pyelogram. These things are important. Okay, if you come to a kidney and ureter, you have congenital anomalies, polycystic kidney, perinephric abscess, calculus. Okay, in majorly in calculus, if you come across the surgical aspect, what surgeries are being done for renal calculus are important. That can be a 5 marks question. Okay, all included, renal disease can be a 10 marks question. Okay, in urinary bladder, if you come, Ashmari is most important question. Ashmari and Ashmari Chikitsa probably can be asked for both 5 marks and for 10 marks. Okay, and in prostate disease, next one is a prostate disease. In that, majorly you have BPH. Okay, BPH is most important question, can be asked for 5 marks. CA prostate. Okay, CA prostate, when it is being asked, we will be expecting you to write a tumor markers or CA markers which are present for CA prostate. Okay, as well as management of CA prostate. So those becomes important headings when you are writing about CA prostate. Okay, next is diseases of urethra. So urethritis, 5 marks question. Then next important one, diseases of penis. So in diseases of penis, Niruddha Prakasha, Parivartika, Avapatika is these 3 are important. Okay, any one among these 3 can be asked for either 3 marks or 5 marks. So try by hearting shlokas of at least Niruddha Prakasha and Parivartika. Okay, you have to correlate these with their respective diseases, phimosis and paraphimosis. Okay, so that can be a potential 3 marks and a 5 mark question. Next, then comes diseases of scrotum and penis. So in scrotum and penis, you can expect torsion of testis, ectopic testis, undescended testis as potential questions. Then in vriddhi roga, you will have hydrocele, varicocele, sorry, hydrocele and varicocele as important topics. Then so another long question which is important here in the part B is your antravriddhi. Very, very important. Antravriddhi or hernia, what we correlate to. A very important and commonly asked hernia is your inguinal hernia. Okay, when your inguinal hernia is being asked, we are expecting you to write its management along with the examination aspect. How you differentiate direct and indirect inguinal hernia, those points becomes important. So okay, so this can be a 5-mark question and a 10-mark question. Inguinal hernia separately can be a 5-mark question. If asked along with the hernia and antravriddhi, it can be a 10 marks question. Okay, so next, so that completes a discussion of the syllabus. So next we'll be discussing about how you will form an answer, how we are expected to form an answer in Shalya Tantra. Okay, so any question you have to start with introduction. Example, hernia itself. So if you are writing about hernia, initially you have to start with the definition or introduction of the hernia. Then you have to write definition, what hernia actually is, the definition of hernia that has been given. Then you have to write the etiology or the cause. Like for hernia, you have cause like heavy lifting or chronic cough, etc. Those can be cause or etiology for the hernia. Then comes the types. Okay, types or classification. In hernia, again, you have different types of hernia. Direct in inguinal hernia itself, you have 2 types. Okay, depending on the position of the hernia, you have multiple types. Those you can write. That is an example. Okay, so then you have to write the classification or types. After that, you have to come to clinical features. So clinical features, don't beat around the bush, be very specific, because in surgery, more specific you are, the more answer you get. Okay, so be very specific with the signs and symptoms. Each disease is having a specific features. Like for example, in appendicitis you are having McBurney's tenderness. In cholecystitis you are having Murphy's sign positive. Okay, in DVT you have Moses and Homan sign. Those important things or important features you have to highlight. Okay, those are called the hallmark features. You have to highlight those features when you're writing clinical features. Okay, then comes the investigation. So this point do not neglect. Okay, you skip, usually when you're writing 5-mark question, we usually skip this point, but don't skip it, write it. You will get brownie points to this. Okay, so this point is very important. So for example, if you're writing arterial disease or a venous disease, you have to mention about the Doppler or CT angiogram. Okay, those things you'll have to mention. Any investigation procedures, don't write CT, BT, CBC. Don't write those things. Okay, be very specific with your answer. Write specific investigations which are indicated in that particular disease. Okay, then comes line of treatment. I told earlier once, when you're writing line of treatment or management, you have to divide the heading into 2: conservative management or medical management, and one more heading is surgical management. Okay, we expect you to write in Shalya Tantra more regarding the surgical management. Okay, in surgical management, you have to be very specific: pre-operative, operative, and post-operative. You have to divide it and then write. Okay, since you're all who are listening, probably you're all 4th year or final year students, you are expected to know the treatment of the disease. Okay, not just the disease, clinical features, and the investigations. You're supposed to know the treatment as well. Okay, for that purpose you have to make this division: conservative management and surgical management. Again, when you're writing surgical management, be specific with pre-operative, operative, and post-operative care. Okay, structure your answer when you're writing. Make it a proper structure and categorize your answer. Okay, so more structural and categorized you have your answer, the more marks you fetch, especially in Shalya Tantra. Okay, try writing relevant diagrams. Like in cholelithiasis or cholecystitis, we are in surgery, we are utilizing the Kocher's incision, for example. So where the incision is, you can write a diagram. In appendicitis, you can mark McBurney's point, or you can draw a diagram of position of appendix. So relevant diagrams will fetch you more marks. Okay, they look more presentable. We do not want you to write whole what do you say, artistic diagrams. Just a linear representation of what the actual surgery is. Okay, so usually what we do when we are being asked one question, example, there is antravriddhi. Okay, so that particular, if you're answering, what we do, we write about antavriddhi, and we do sometimes miss the allopathy aspect. Majority will not, but still, you have to write both. When it comes to 10 marks question, try writing at least one page regarding the correlation. If majorly ayurveda is being asked, example bhagna is being asked, you are writing everything about the bhagna types, management of bhagna you're writing. After that, try writing at least one page about fracture and its management. Okay, so in 5 marks if you're writing, try writing it to half a page, and in 3 marks at least mention the correlation. Okay, so if you mention, so these are a few tips to earn brownie points in your paper. Okay, so what you can follow, few tips in Shalya Tantra, is revise twice. I would prefer you to revise whole Shalya Tantra topics twice. Okay, once concepts become more clearer. Okay, so revise at least twice. Use a quality notes at least from it. Okay, use quality notes. Then take each day as a challenge. Every day you want to finish some topic, keep it as a challenge and finish it. Okay, that way if you finish, you'll finish faster. Okay, you can keep away all the distractions. Then take short breaks, don't take long breaks, don't try sleeping in between. Take short breaks, as I told initially in starting of the lecture. Put away your phone, do some pranayama or yoga, you can read better. Okay, and don't postpone the syllabus points. If you postpone the syllabus points, you will not be able to finish those points, and in exam when that point comes, you will say, "You I had left that point." So don't make that. Don't leave out any syllabus point. Try covering everything. Okay, next. Yeah, all the best for everybody who is listening. All the best for your exams, not just Shalya Tantra. Do all the exams very well. Be confident. Be bold enough when you're writing your paper. Don't hesitate, but don't write rubbish. But whatever you know, if you're bold enough, probably you'll remember better. Okay, so be bold and write the paper. All the best for everybody who are writing the question, who will be attending the exams, and thank you. Okay, first of all, I thank Jignasa for giving me such a beautiful opportunity. We have heard about Jignasa since we were in UG, so it's like a dream come true presenting here at Jignasa. Thanks to all the conveners for making it so easy to present here. Thank you all. Over to you, Karthik.
Thank you, ma'am. It's actually a dream come true for us to host you, ma'am. I would say that, ma'am. Thanks for accepting the invitation on such a short notice, ma'am. Despite the schedule you had, despite the academic schedule and the time constraints, thanks for accepting our invite to deliver a lecture on Shalya Tantra on our first interaction only. Thanks for being so supportive and cooperative, ma'am. Ma'am, there's a question in the chat box, ma'am. Shall I read that out to you, ma'am?
Yeah, please. Yeah.
Yeah, ma'am. Thank you, ma'am. The first question is, ma'am, for TNM classification, is it necessary to? I think the question is incomplete.
The question is incomplete, I guess. But yes, when you are writing about tumors, any tumors or CA, if it is being asked, TNM classification to be written is very important. If the question itself is like that, if it is 5 marks or 10 marks, yes, TNM classification is necessary. It's not that difficult as you think. Okay, TNM classification, if you split it out, tumor, nodes, and metastasis. Example I gave you about CA esophagus. If you take CA esophagus as an example, tumor, according to the extent, Depending on the layers, the T will go on. Okay, T1, T2, T3, or T0, T1, T2, T3 will go on according to the layers. Okay, in every TNM classification, it is like that. N is nodes. Either it can be N0 or N1 or N2. Okay, so yeah, that's what I'm giving. So nodes usually it will be present or absent. Okay, N0 or N1 or N2 depending on the stage. Okay, then comes your metastasis. First, what you have to using your common sense, what you'll think, the tumor first, it will be spreading to an adjacent organ. Okay, if at all it is CA esophagus, uh, the usual metastasis that can happen is to the lungs, is to the liver, and is to the stomach. Okay, so those things you will have to remember when you're writing the TNM classification. Okay, TNM staging and TNM classification is very much important when the question demands it, especially in tumors and in CA. It is necessary when you're writing investigations or when you're writing about the management. Either in the two headings you will have to mention about TNM classification.
Ma'am, ma'am. Uh, I think the student has framed her question
Yeah,
completely, ma'am. The
I
question is,
I,
ma'am,
I saw, I saw.
yes, ma'am. Yeah, yeah,
I
ma'am.
saw. That's what it is
Okay, ma'am.
necessary. Yes, I think it is Sneha Raibagi. Yes, it is
Yes,
necessary
ma'am.
that you have to mention TNM staging or TNM classification in CA. Without that, it is difficult to stage. So when you're diagnosing, it becomes an important aspect.
Thank you, ma'am. Um, Viewers, I request if there are any questions, any more questions or doubts regarding the Shalya Tantra exam or the fourth year exams, you can start posting those questions in the chat box, and I'll be reading that out to ma'am, and ma'am will be answering your queries. We will wait for another 3 minutes. Ma'am,
Okay,
there's a
there is one
question.
question.
Yes, ma'am. The
There
question
is
is
any
there. Is
generalized
there any?
TNM classification? See, that was my understanding. See, what I used to remember TNM classification, that I told. Okay, so there is no generalized TNM classification. Um, we just use our what do you say, a little extreme senses, or to remember few things you have to do few tricks. Okay, so easier way to remember TNM classification is by that. There's no generalized one. TNM classification changes according to that particular organ.
Thank you, ma'am. Thank you for the answer. Uh,
TNM classification has become a big demon for everybody, I guess. Even my students keep
based
asking about that.
Uh, I guess it's right, ma'am, because based on the questions, so the many students are asking regarding the same. I think it is. Though I am a third year student, I can sense it from the chat box.
Any other questions, let me know, or if not possible here, you can contact me. Karthik can pass on my contact details. You can
Yes, ma'am.
ask your
Sure.
questions through mail or through WhatsApp. Any questions regarding, yeah, there's one more, I guess. All triads and signs are to be memorized. Memorize it as much as possible in specific diseases like appendicitis, cholelithiasis, cholecystitis. Those specific triads which are very much famous, those are potential questions. Okay, so those you'll have to memorize. The others which are rare, okay, those things you have. Murphy's triad is regularly asked. Okay, so those common triads you will have to memorize. Yes, all are not necessary, but you'll have to. Yes, a few which are very commonly asked, like what I told, the Murphy's triad. Those things are, and you have in appendicitis, you have one triad. Okay, so those things, that is Murphy's triad. Okay, sorry. Those things you'll have to remember. There's no other options other than that. It is difficult. The syllabus is vast, but you have to adapt few things in order to remember.
Thanks for clarifying the doubts, ma'am. I think there are no more questions for the students. So, proceeding with that, I would like to thank you again, ma'am, for all the cooperation and support you have given us throughout the lecture series. And thanks for being a part, ma'am. When I was texting you, I still remember I started explaining about Jignasa, and you told I am in Ayurveda from many field from many years. I know about Jignasa, Karthik. That was the moment when I felt proud about our organization, its reach, its works, because we thought morely our activities are concerned and being done in and around Bangalore. So a teacher who, like I'm explaining based on geographics, ma'am. So a teacher who is in Davangere knowing about our organization. It was like a moment of feeling proud. I took proud in that, ma'am, because the whole purpose of reaching out to many colleges and conducting lecture series was this, ma'am, to organize and create an establishment of Jignasa all around Karnataka and every district. So that's when I felt very good as our organization was already reached. So that was really a warm message, ma'am, what you sent that day. So thank you for personally, thank you for that also, and for all the support you have given. And to mention one more person who helped us in getting your contact, there's actually a student named Sneha, who was in our college. She through her friends and her contact teachers, she got your contact, ma'am. And I think she has helped a lot in getting you on board. So thanks to her also for getting you on online, ma'am, with us. So, and you also for agreeing the session on our very first interaction and being supportive and suggesting how it can be done, and everything and all the interactions we have had so far. uh, Personally, on behalf of my whole organization, on behalf of my whole team at Jignasa, I would like to extend our warmest greetings and thanks to you, ma'am, again. And in future also, we look forward to collaborate with you. We look forward to work for the benefit of Ayurveda students and Ayurveda fraternity in upcoming days also, ma'am. We look forward to work hand in hand with you. And I request your continuous support for all our activities in the future also, ma'am.
Thank you, Karthik. Actually, what you told, Jignasa might be new for you, like, but since our UG days, we are hearing about Jignasa. So don't worry, Jignasa is having reach to a very wide population in Ayurveda. So it was actually my honor or my privilege to be joining you guys. I was overwhelmed. Like somebody has taken my name, that too with Jignasa. Jignasa, uh, according to us, is a very big platform. You might not understand its reach, but Jignasa has a very wide reach. Okay, so getting an opportunity at Jignasa is it was a pleasure of mine. Thank you so much.
Yes, yes, ma'am. What I wanted to convey is we had a very good reach in Bangalore, Mysore, Hassan, Udupi, Mangalore, this part, ma'am. But we had very less reach in Chitradurga, Davangere, Tumkur, Hubli, that belt, ma'am. So we got to know by you that there's a person, teacher who knows about Jignasa and working in Davangere. So we as an organization felt overwhelmed that there will be a person in future who will help us in organizing many more activities in that region, Chitradurga, Davangere, Tumkur belt. So you are like a door to us to grow in that region also, ma'am.
Sure, Karthik. We'll join you anytime you want us.
Thank you, ma'am. Thank you, ma'am. By that, I request you to conclude. I request you to end the broadcast, ma'am.
Yeah.
Request your permission to end the broadcast. Shall we, ma'am?
Yeah, Karthik. Yeah, sure. Thank you.
Thank you, ma'am. And thank you for all the viewers who have joined us today. I hope, we hope this has benefited to you. So, thank you again.